Module 8.1 Hearing Exams. If you want to find out about your hearing, either to get some baseline information, or because you are experiencing hearing loss, or you're hearing things when there is no sound around, you will go to visit an audiologist who will give you a hearing exam. A basic hearing exam will look at the functions of the three main sections of your ear. First, the audiologist will use an otoscope to examine your outer ear and eardrum. An otoscope is basically a magnifying glass with a bright light. It is likely that when you go to your regular doctor, they look in your mouth, nose, and ears with a small instrument with a light. An audiologist's otoscope is similar. Newer otoscopes can be hooked up to a video monitor for better viewing. With the otoscope, the audiologist can see if there's anything in the ear canal that may be blocking sound. Excessive earwax is common, but audiologists delight in telling about the many strange objects they have found: broken Q-tips, pencils, crayons, gum, insects. The list goes on. The otoscope also lets the audiologist see the eardrum. They can often tell by looking if there is a rupture in the eardrum or if there is fluid in the middle ear or an infection. To test for problems in the middle ear, a tympanometer is used. A small foam tip is inserted into the ear. The tympanometer changes the amount of air pressure in the ear canal and measures the movement of the eardrum. The machine graphs the movement. A normally functioning eardrum will cause a display that looks like an upside-down V. If there is a tear in the eardrum or fluid in the middle ear, the graph will be flatter or shifted to one side. Inner ear function is tested with an audiometer. The patient puts on a pair of headphones, and the audiologist plays a series of tones at different frequencies and different dB levels. The patient raises his hand or presses a button when he hears a sound. The test results are compared with the equal loudness contours and then graphed. The graph is called an audiogram, which shows your hearing level, the y-axis, at different frequencies, the x-axis. A person with normal hearing will have an audiogram that is a straight line at 0 dB hearing level. I find it useful to think of the y-axis, hearing level in dB, as hearing loss rather than hearing level. We will talk about what happens when you're exposed to loud sounds in the next module. To review, an audiologist is a doctor who specializes in treating hearing loss. An otoscope is a device for visually inspecting the outer ear and the eardrum. A tympanometer is used to check the condition of the middle ear. An audiometer is used to check inner ear function. An audiogram is a graph of hearing level at different frequencies.